Hey guys, Dr. Mike here at Complete Wellness. Today I want to talk to you about a condition called fibromyalgia. So if we look at who fibromyalgia affects, it's now up to 10 million US citizens, mostly adults, and actually 75% of those are females. So let's look at the possible symptoms. The main one is multiple points of pain, musculoskeletal pain to be specific. It's also linked with poor sleep, which can lead to fatigue, memory or cognitive loss, mood changes, possible headaches, specifically migraine headaches. Other possible symptoms include numbness and tingling into the hands and feet, temporal mandibular joint syndrome or facial pain, digestive problems. It's linked to things like abdominal pain, bloating, constipation, even irritable bowel syndrome. So the diagnosis of fibromyalgia becomes very complicated. It's an exclusion diagnosis. The first thing that you're going to do, specifically rheumatologists are the ones that diagnose this condition, so they have to rule out other conditions such as anemia, chronic fatigue syndrome, multiple sclerosis, rheumatoid arthritis, osteoarthritis, and a few more. What the diagnosis then takes place that happens is they do a widespread pain index where there's 19 points across the body and you get a score 0 to 19. Also associated now is a symptom severity score. It becomes very complex and you have to have a specific set of numbers to be diagnosed. But what this is if you have a lot of areas of your body that are extremely sensitive to touch and are painful with all of the other associated symptoms, you probably have a condition called fibromyalgia. So there are three types of medications designed to treat the symptoms of fibromyalgia. Remember, a lot of medications are solely designed to treat the symptoms of a condition or disease, not cure or fix the cause of what caused them in the first place. The three types are pain relievers. The whole goal is to decrease pain. Obviously, antidepressants. The whole goal of prescribing these is to decrease pain and reduce fatigue. And then anti-seizure drugs are designed to decrease pain as well. So let's look at the top one. We have Tylenol and ibuprofen, over-the-counter drugs. So the problem with these, if you take too much, you will get liver and kidney damage. A study done in the New England Journal of Medicine found that on average it takes about 1,000 Tylenol in your lifetime to cause end-stage renal failure. So what does that mean for chronic conditions like fibromyalgia? Well, if you take one a day for 3 years, you're at your limit. You're really increasing your likelihood of liver or kidney failure. If we look at antidepressants, common ones prescribed are Cymbalta or Sabella. Common side effects or symptoms, side effects of these drugs, okay, treating the symptoms again, is suicide, which obviously is a horrible side effect, vomiting of blood, dizziness, constipation, diarrhea, drowsiness, fatigue, headache. Wait, weren't a lot of these what the symptoms of fibromyalgia were? That's weird. Then we have anti-seizure drugs, remember, designed to decrease pain. Popular one is gabapentin or Neurontin. Lyrica was once the first one prescribed for fibromyalgia. So common side effects are dizziness, drowsiness, memory loss, viral infections. Viral infections. We know a lot about that lately. Tremors, fever. So yeah, again, causing a lot of the same things that it's designed to, well, no, it's just treating pain. Right, because drugs don't fix everything. Then we have Lyrica, which causes chest pain, productive cough, where you're actually coughing up mucus, difficulty breathing, muscle aches, wait, muscle aches, fibromyalgia, another link there. Seizures, wait a minute. Anti-seizure drug can cause seizures. Okay, diarrhea, joint or muscle pain, wait, again, fibromyalgia, joint causing, okay, and then tiredness. Alright, so obviously my sarcasm points to the fact that a lot of these drugs that are given to help people with the symptoms cause other symptoms that people get when they get fibromyalgia. So again, it's not a cure to this, and the side effects are really bad when we look at all these medications. So what's another option? There's a lot of information out there on natural treatments. We're going to try to point in the right direction with some of the ones that we've seen great results with, and other healthcare providers that do natural treatments also are getting really good improvement of the symptoms with zero side effects. Now let's talk about the foods to eat and the foods to avoid. The foods you want to focus on eating are vegetables, a lot of green leafy vegetables. Green leafy vegetables are full of things like magnesium, which again is a supplement that you should take, but it's better to get it from your food actually. A lot of vegetables also have melatonin to help you sleep at night. Fruits, a lot of your lower glycemic index fruits are really good. You want to really eat dairy or milk alternatives, things like almond milk, coconut milk, kefir, butter, things like that are really good. Grass-fed butter, if it's butter. Herbs and spices, things like turmeric are really good to cook with. They're very anti-inflammatory. Ginger as well. Vitamin D rich foods. These are things like wild-caught fish. Things like mushrooms have a high level of vitamin D in them as well. Really focus on gluten-free breads or grains if you're going to do that route. There's a lot of good products out there. And then nuts and seeds. Obviously you don't want bad oils in these, so you want to make sure they're either raw or in butter form. If they're roasted, make sure they're not roasted in bad oils. Foods to avoid. You want to stay away from anything sugary or has artificial sugar in it. Even fructose, you want to stay clear of honey and even apples, which have high fructose levels in them as well. And again, this is for hopefully a treatment protocol, so you're trying to cure things, so it's not forever, hopefully. You want to avoid dairy. Lactose is very inflammatory. A lot of people don't do well processing it. Same thing with gluten. Avoid wheat or gluten. Something called galactans. Things like legumes, lentils, soybeans, and soy products. You want to really lower your caffeine intake. And that's not just coffee, that's sodas and other things you probably shouldn't drink anyways. You want to really limit or totally reduce your alcohol consumption. And you want to absolutely don't do any processed foods, especially those with a lot of preservatives, artificial sweeteners, and chemicals in there. You want to absolutely avoid those like the plague. So, foods to eat, foods to avoid, these are really crucial for helping you with your fibromyalgia. There are many natural ways to treat the symptoms of fibromyalgia and even help cure what caused it in the first place. A lot of studies show that inflammation is a main precursor to fibromyalgia. Not just inflammation of the musculoskeletal areas, but also of the brain. So neuroinflammation has been linked, especially in current research, to fibromyalgia symptoms. So when we look over here, let's start with supplements. There's a lot of great supplements out there, and there's a lot of them that are going to be different for each individual with each symptom that occurs with fibromyalgia. So let's start. In general, vitamin D, almost everybody in North America is low in vitamin D, specifically D3. Studies show that up to 70 to 80% of Americans are extremely deficient in vitamin D, which is hugely linked to inflammation and fibromyalgia. 5-hydroxytryptophan is actually the precursor to serotonin. Serotonin helps with sleep, helps with mood, and is great for treatment with fibromyalgia. GABA is a neurotransmitter that is involved with a calming effect. It actually will help get you in deep sleep, keep you asleep longer, and just in general has a calming effect. If you're sleeping well at night, you're going to have more energy throughout the day, your mood is going to be improved. Sleep is extremely important. Now, our favorite for fighting inflammation is a kit called the Deflame Kit. It's designed to lower systemic inflammation. In it is omega-3s, which is fish oil, you have turmeric, you have ginger and rosemary, and you have whole food bioflavonoids. All are anti-inflammatory, all work just a little bit differently in the body to reduce inflammation. As far as digestion and mood go, probiotics become extremely important with this. And lastly, magnesium is a fantastic supplement at helping you sleep, helping with digestion, and helping with muscle pains and aches. So we move over here to exercise. Exercise is sometimes counterintuitive with fibromyalgia because you're in a lot of pain, and when you're in a lot of pain, you don't really think that going to exercise will cause you less pain, you think it will cause you more. Studies have proven otherwise. Even just light movement, walking for instance, helps decrease pain, helps increase neurotransmitters naturally like serotonin and GABA, increase neuroplasticity, which is your neurons connecting, making those connections in the brain, and ultimately helping with better memory, better cognitive function, and decreasing pain. And also, exercise helps with digestion too. Now, things like prayer and meditation become really important because with fibromyalgia, you have high stress levels, you're not sleeping well, you're not thinking well, so taking time to just rest, calm your mind, calm your brain, whether it's prayer or meditation, they're a great way to allow your brain to just relax. And chiropractic has been shown very, very helpful in limiting the fibromyalgia flare-ups and ultimately can, and I've seen it be a cure to a lot of people's fibromyalgia. With this, you have to normalize the nerve signals in the body. If you have nerves that are being pinched, pulled, altered, those nerves are going to fire a lot and you're going to have a lot of pain. X-rays are critical with this because a chiropractor needs to see exactly where the nerves are being pinched or pulled or where the spinal cord is being influenced as well. So balancing your sympathetic and parasympathetic nervous systems are also extremely important. We see a lot of fibromyalgia patients with major sympathetic nervous system damage. Their sympathetic nervous system is basically stuck on and they're having a hard time getting into that deep sleep at night that is critical for the body to repair itself. Lastly, massage has been proven to be very good with this. It's going to decrease tight muscles and trigger point areas and also increase the range of motion and help get the inflammation out of those damaged tissues. There are so many natural treatments for fibromyalgia, and these are just quite a few of the ones that we've had great success with over the years. But if you have fibromyalgia, you think you might have it, or you know somebody with it, please point them into this direction for natural treatments. There are no side effects to many of these treatments, and they're highly effective at reversing the cause of fibromyalgia.